There is an ever increasing population. There is longevity where people are living a lot more longer than what they used to. There is improvement in the socio-economic status of the population, improving diagnostics, better understanding of the disease pathology, advancing surgical technology and techniques have helped in management of cancers. Cancer derives its name from carcinos, which in Greek means claws of a crab. And this carcinos has got a link with Sanskrit, which again translates to the same as crab claws. This was described by Hippocrates going back to centuries. Although the cancer has been prevalent for such a long time, the real initiation for chemotherapy started off after the Second World War, where the organ gas triggered off investigations into chemotherapeutic agents. From then to now, where we are talking about targeted therapies, precision-based oncosurgery, laparoscopic surgery, robotic surgery, etc. for cancers, we have come a long way. We in India, the average lifespan is about 68 years compared to the West. For example, UK, the average lifespan is 81.3 years. Sweden, 82.5 years. So the longer you live, the more the incidence of cancers. When such is the case, it is important to understand more about bowel cancers. In an urban setup like Bangalore, there are 4 colorectal cancers picked up per 100,000 population per year. So what is a cancer? Cancer is an overgrowth of the cells of the bowel, where there is a loss of control over the growth of these cells, leading on to a cancer. This tends to invade the surrounding tissues and also tends to metastatize or go to distal organs away from the site of its origin. Cancer kills. Cancer causes significant symptoms such as bleeding, change in the bowel habit, weight loss, anemia, so on and so forth. It is therefore important to be aware of the symptoms of bowel cancer and seek help when there is a change to the normality of their bowel pattern. The bowel cancers could be located within the right side of the colon or the middle bit of the colon, what we call as transverse colon, descending colon or the left side of the colon, rectosigmoid, which is the distal and the left sided part of the large bowel, rectum and anal canal, which is the last bit of the large bowel. So it is very important we as clinicians create this awareness within the general population so that patients are aware of the warning symptoms of cancer. And if caught earlier on, they can be treated and patients can be cured of cancers. The earlier you pick up a cancer, the better the outcome. We in India do not have a screening process for bowel cancers, given the low incidence compared to the West, but certainly the incidence of bowel cancers is on the rise. There are pockets around the country, such as the northeast of India, Kerala, Bangalore, where there is increase in bowel cancers. This could be related to the lifestyle, the food we consume, the red meat, the processed fish, etc. It is important that we create awareness amongst the general population and make the patients seek help when there is a change from their normality. When patients present with bowel symptoms or warning symptoms of cancer, it is important to undertake a thorough history, a detailed examination, put them through tests including a fecal occult blood and a gold standard investigation such as a colonoscopy or a CT virtual colonogram. Once the diagnosis is made, you need to stage the disease to see whether this cancer is located just where it is or has it spread elsewhere. For a surgeon, this is where the difficulty is, and hence he takes help from the tumor board where there is a multidisciplinary team that would decide on the treatment options for the patient. We also take help from decision-making tools such as IBM Watson, which is based on artificial intelligence, and put forward the data in front of the patient and discuss the various treatment options with the patient. And what we should be aiming for is to treat the person who's harboring the cancer rather than treating the cancer itself. And this is where decision making gets trickier. In summary, cancer is a significant problem. It will be one of the major non-communicable diseases which will be a huge burden to the society with time to come. It is important to create that awareness in the community, and patients should start coming forward with warning symptoms, early diagnostics, better imaging, better decision making can lead on to good surgery. And these days, with improving technology and tools, you can undertake a surgery laparoscopically, which is a keyhole operation, robotically, and at times even an open operation where situation dictates. And it is important that we measure the surgical outcomes to see how we have done.